If you're living with inflammatory joint pain, this video is for you. Namaste, this is Dr. Rashmi, an Ayurvedic physician as well as a dietitian. If you're watching this, chances are you're living with joint pain that doesn't behave normally. Some days you wake up stiff, especially in the morning. Some days the pain moves from one joint to another. Some days the swelling is visible and other days it burns. Some days it feels deep and aching, and some days you are exhausted even without doing much. You may have been told different names to your problem like rheumatoid arthritis, inflammatory arthritis, gout, autoimmune arthritis, chronic joint inflammation, etc. But whatever the label is, what you are actually living with is unpredictability. Pain that comes in waves, fear of worsening, confusion about food, activity, and treatment, and the feeling that your body is no longer reliable. If any of these speaks about you, then this video is for you. Watch till the end. And why does this pain feel different from the usual joint pain? Let me say this clearly. Inflammatory joint pain is not the same as the age-related wear and tear. The usual joint pain improves with rest. It stays local and it doesn't affect your whole body. Whereas inflammatory joint pain worsens after rest, especially in the morning. It comes with stiffness. It may involve swelling, heat, or tenderness. It often affects more than one joint and is usually accompanied by fatigue, heaviness, or digestive discomfort. Many people sense this difference long before any report can confirm it, and that intuition is correct. Approaching an Ayurvedic physician at this stage helps the best. Your body is not dealing with the local joint problem. It is dealing with a system level imbalance that expresses itself in the joints. Most people suffering from inflammatory joint pain share similar experiences like, I don't know what triggers my flare. Some foods suddenly don't suit me. I feel heavy and stiff in the morning. Painkillers help temporarily, but the problem returns. Exercise sometimes helps, sometimes it worsens it. I feel tired even when the pain is not severe. I'm scared of long-term damage to other parts of my body. I don't know what I am allowed to do anymore. This uncertainty is often more distressing than the pain itself. What I want you to know is this. The symptoms are not random. They follow patterns, even if you may not have identified them yet. Let us understand why general advice often doesn't work for you. Many people are given general advice by relatives and friends like avoid certain foods, exercise regularly, lose weight. Why are you taking so much of stress? Take this supplement, take that supplement, may rest more. But inflammatory joint conditions don't respond well to these generic rules because the same advice can help one person and worsen the symptoms of another person. For example, fasting may reduce pain for some, but it can increase the stiffness and weakness for others. Exercise may improve mobility for some, but it can trigger flares in others. Certain foods may be tolerated on good days, but the same food can cause flares during sensitive phases. Inflammatory joint pain has stages and patterns, and that is why there is this difference. There are phases where the body needs calming, lightness, and rest. There are phases where the body needs nourishment, strength, and gradual movement. Without recognizing which phase you are in, a well-meaning advice by friends can actually backfire. This is why many people feel that they have tried everything, but in reality, they have tried unsequenced approaches. Let's understand how Ayurveda looks at all these. Ayurveda does not see inflammatory joint pain as a single disease. It looks at how your digestion is functioning, how your body handles food and metabolic load, how inflammation builds and clears, how circulation reaches the joints, how rest and movement affect your symptoms, how predictable or unpredictable your flares are. And most importantly, it asks, why is this person inflamed in this way at this particular time? Two people with the same diagnosis can need very different approaches. That is why responsible Ayurvedic care never gives a standard diet list, a universal medicine, or a one size fits all protocol. Because the body you live in is not generic. The goal is also not to suppress pain. The goal is to help the body reduce the conditions that keep producing inflammation. Now, let's understand what you can start doing safely without self treatment. I won't tell you to start or to stop any medicines on your own. That can be dangerous. But there are some safe observational steps you can definitely begin with. For example, start noticing patterns instead of fighting symptoms. Which joint flares first? What time of the day is it worse? What happens before a flare? For example, is there any change in food? Has there been a travel or a stress? Or how was your sleep? Then, point number 2, stop forcing your body during flares. Inflammation is not the time to push through. Gentle movement is different from exertion. Number 3, protect digestion during painful phases. Heaviness, bloating, loss of appetite, all these often worsen joint symptoms. When digestion struggles, joints often flare. Ask me in DM for signs you can be watchful about. I will help you. Then point number 4 is respect recovery time. Inflammatory bodies need more time to recover. Most importantly, these steps don't cure anything, but they stop unnecessary aggravation and give you clarity. I want to be very honest here. Know that your joint inflammation conditions are complex. They're not fixed overnight. There is no guarantee of cure even. But here is the hopeful truth I have seen repeatedly. When the pattern is understood, when triggers are identified, and when digestion and inflammation are addressed together, when movement and rest are guided properly, and when treatment is personalized, many people experience fewer flares, reduced intensity of symptoms, better mobility, and more predictable days, as well as improved quality of life. The body is not your enemy. It is reacting to something it cannot process yet. And with the right guidance, that processing can improve. If you feel this video described your experience, not just your diagnosis, but your day-to-day reality, then it may be time for you to stop experimenting on yourself alone. Ayurvedic management of inflammatory joint pain requires careful listening, pattern recognition, stage-wise correction, and personalized planning. This is the kind of work that I do with all of my patients. Not quick fixes, not blanket advice, but thoughtful individual guidance. If and when you feel ready to explore that, you can begin with a simple consultation. Sometimes even clarity itself can be a relief. And before I close, I want you to remember that you deserve care that understands your body, not just your reports. Hope this video made sense. Take care. Namaste.